All right, good afternoon, everyone. Welcome. We appreciate you joining us today for our support level review request process training. You have joined a Zoom webinar. This means that your camera and your microphone are automatically muted. Zoom will provide us with an attendance report, so there's no need to put your name and your agency into the chat. I do want to let folks know that I will be turning off the chat for folks attending this meeting after this slide. We will be asking folks to put any questions they may have about the training presentation into the Q&A at the bottom of your screen in Zoom. We also want folks to know how to use the React button in Zoom today because we're going to be using those emojis to ask you guys some questions and some knowledge checks later. So feel free to look at the bottom of your screen, find that React button, and feel free to share some emojis as we're waiting for training to get started today. I want to take a minute to introduce myself. My name is Lydia Beals. I am a Training and Quality Assurance Specialist here at the Department of Healthcare Policy and Financing. I'm going to pause real quick and remind folks that we do not need your name or your case management agency submitted to the chat. Your Zoom registration is how we will be taking attendance. All right, I wanted to let you guys know that I previously worked as a community center board case manager as a lead in a rural area of Colorado for about 10 years. And when I began at the department as a policy advisor, I was trained to be a support level review panelist in addition to other job duties. We want to thank you all for joining us today for our support level review request process training. We are going to ask that folks use that Q&A again to submit any questions to the department as we go through this training. Please remember that we do have 2 office hours that are scheduled after the completion of training. Case managers, case manager supervisors, and CISLA contacts are encouraged to register for an office hours session so that you can ask any specific questions you may have after listening to the presentation today. We appreciate all the steps and work the department and case management agencies have put into this training preparation. Thank you again to those of you who participated in our case management agency feedback sessions. Your feedback on the support level review process helped us to update our forms and build this training today. Again, as I said earlier, we're going to have a few live knowledge checks in our training, so please go ahead and find that React button in Zoom. Know that it is a heart symbol if you're looking for the symbol. Once you find that React, you may have to select the 3 dots to add additional emojis to your options. In later questions, you're going to be asked to find a rabbit, a tiger, a turtle, or a whale. So please take a look at those reactions now and select something to identify how you're feeling about starting our SLR request process training today. Thanks, folks. I do see those emojis and I appreciate them. I'm going to go ahead and turn off the chat now, so please remember that you need to use the Q&A if you want to ask the department any questions about this training. Let's take a quick look at the HCPF mission statement. It is improving healthcare equity, access, and outcomes for people we serve while saving Coloradans money on healthcare and driving value for Colorado. Here's our agenda for this training. We'll be talking about the support level review request process and giving you a high-level overview of the workflow for case managers. We will also talk about the ways support level review requests can be submitted to the department and what the department review process looks like on our end. We'll go over the support level review request form, the updated desk guide, which includes a case manager pre-submission checklist, the provider responsibilities resource. We're going to be working with providers to make sure that they have a better understanding of their responsibilities in the support level review process as well. Later in the presentation, we'll be covering the SLS exceptions process and some of the changes coming to the HCBS SLS waiver in July. We'll also talk about how risk factor values impact support levels for members on the HCBS DD and SLS waivers. We will also be discussing support level review request non-approvals and the dispute process. Finally, we'll walk you through 2 scenarios of HCBS SLS SLR related appeals. If we have any questions, if we have additional time at the end of this presentation, we will open the meeting up for questions. Please be sure to pay attention to some of the links shared in the chat today, as these will get you to the resources mentioned in this presentation. Thanks to Nadine Smith for putting them in the chat for us. All right, let's talk about our training objectives for the day. By the end of this training, we want to ensure that case managers have a better understanding of when to start the support level review request form process with members, guardians, and the member identified team. We want to ensure that case managers are able to utilize the new support level review request form starting on April 1st. This includes using the new desk guide and other new support level review process resources demonstrated in this training today. We want case managers to have a better understanding of how they will communicate member-supported needs for services succinctly to the department by submitting a detailed information in their support level review form for the SLR panel to review. Finally, we want to make sure that case managers understand that members on the Children's Habilitation Residential Program, or CHIRP waiver, will now be participating in the support level review process for any changes to their requested support levels. Throughout our training today, we will be offering a few knowledge checks. Please remember that there is no one recording your answers. We encourage everyone to participate in these knowledge checks to help solidify your understanding of the key takeaways for this training. Let's take a look at the SLR request intent and an overview of the process. Support level review forms are used to communicate to department staff your members' needs and justifications to ask for increased support level funding for a member's service plan. Please remember that the support level review panel will be using the documentation in the form to base their decisions off of. The department does not use additional documentation outside of what we teach you guys today in our training. This would include activity logs or provider letters. Those are not typically submitted with SLR request forms. The department expects that the support level review form will demonstrate current and comprehensive information about the member's needs, concerns with their current services or providers, and the general outcome of the support level increase what the support level increase would help to achieve. Case managers can use the SLR form to plainly communicate a comprehensive and compelling details as to why their member would benefit from an increased support level. All of the details must be listed directly in that SLR form. Now I'm going to welcome Brianna Holmes here to give us some additional overview information.
Hi, everyone. My name is Brianna Holmes. I'm the Child and Youth Complex Service and Support Specialist in our Case Management and Quality Performance Division within the Office of Community Living at HCPF. To reiterate what has already been shared, the updated support level review request form is designed to clearly and comprehensively capture the complex factors affecting a member's needs and identify gaps in current services. A key update is that the Children's Habilitation Residential Program, or CHIRP waiver, SLR process, will be integrated into the existing adult SLR process. This creates greater consistency and alignment across all programs. You'll see this reflected throughout the updated form and supporting materials, including added references to children and youth, school districts and educational systems, and county child welfare services. As we move toward the implementation of the Colorado Single Assessment, aligning all related processes, including SLRs, is critical. It's important to note that many SLR denials stem from a lack of clarity rather than a lack of need, often due to incomplete or unclear case narratives, waiver and state plan services not being fully explored or documented, insufficient explanation of the gap between the algorithm support level and the member's actual needs, or unclear funding plans and provider roles. The purpose of this training is to help case managers think from the SLR panel's perspective and strengthen their ability to clearly and effectively advocate for a member's needs when submitting a support level review request. Back over to you, Lydia.
Thank you. All right. Let's take a look at a step-by-step outline of the support level review process from a high level. When members enroll into the HCBS, CHIRP, DD, or SLS waivers, they're assessed for their support level through the ISLA or the ICAP assessment. Remember, ISLA is Interim Support Level Assessment. And I apologize, the ICAP spelling is on a different slide, so we'll cover that later in the presentation. Members who are already established on the DD or SLS waiver may have a supports intensity scale or SIS assessment that determines their support level. Case managers are responsible for uploading these assessments into the CCM document center of their member record. Members, guardians, and others from the member identified team will notify the case manager of any changes in the member's condition or needs that may warrant discussions and potentially a support level review request. When a case manager is contacted by any member, guardian, or someone from the MIT regarding a change in need, the case manager will document this request in a CCM activity log. The case manager will then schedule a member-identified team meeting to review any options a member may have to address their additional support needs. Case managers must exhaust any alternative options before determining that a support level review request is necessary. When a case manager determines that a support level review request is needed, they will discuss the SLR process with the member and their member-identified team. Case managers will need to gather details from the member and the team to complete the support level review request form. The case manager will also need to share their drafted support level review request form with the member, guardian, and any involved providers to review the request for accuracy. Next, the case manager will share the support level review request with their supervisor for a secondary review. Once the support level review request form is approved by the case manager supervisor, the contact at the case management agency for support level reviews will submit the SLR form to the support level inbox. The support level review panel will then determine and review the request for any additional documentation provided. The department will notify the case manager of the outcome of the SLR request in writing within 15 business days. It's very important to note that the case management agency is responsible to deliver the support level review decision letter to the member, guardian, or legally authorized representative. This is documented in rules and regulations. We'll now share that reference in the chat. The SLR submission process has not changed. Please submit completed forms and documents to the newly renamed support level inbox. All case management agencies must have a designated support level review point person. Only this designated contact will be submitting forms to the support level inbox. This inbox can also receive ISLA-related questions and bridge PAR issues. If you have any questions about the form or the SLR process in general, please email the case management inbox. Be sure to download the new support level review request form, desk guide, the service utilization form, the pre-submission checklist for case managers, and the provider responsibilities documents from the department's LTSS tools website. The department will require case management agencies to implement the new SLR forms and resources starting on April 1st. The department will need to automatically reject any support level review requests submitted on the old SLR form starting on May 1st. On this date, May 1st, the CHIRP SLR Google form will also no longer be active for use, as HCBS CHIRP members are included in the SLR process starting on April the 1st. So some important timelines for you guys to remember here. If a case manager is assisting an HCBS CHIRP member to request a support level 6 or 7, or an HCBS DD member to request a support level 7, the request must include a level 7 rate request form. The department cannot review the SLR request without the level 7 rate request form. In cases where a provider hasn't been identified yet, the SLR form can be submitted without the level 7 rate request form, but the department cannot issue a rate until the provider submits a budget spreadsheet. Case managers working on negotiated rates for CHIRP members asking for a support level 6 or 7 will need to submit any additional supporting documentation to the support level inbox. We wanted to clarify examples of the supporting documentation needs for demonstrating the complex needs of a CHIRP member. The supporting documentation is required to justify the request, and this may include a copy of the member's psychological evaluation or other behavioral evaluations, an IEP, ABA, or other therapy care plans and notes, critical incident reports, hospital or nursing notes, and recent medication changes. Case managers can determine if there is any additional supporting documentation that they need to submit to justify the SLR request form. All right, now that we've covered the support level review request process overview, let's check in on your understanding. Remember, you're going to be looking for those emojis in the React button at the bottom of your screen. No one's tracking your answers. We're just trying to figure out if attendees are understanding this training. Here's our question. When a member, guardian, or provider requests a support level review, can a case manager complete the support level review form and submit this to the department right away? So here you can see some emojis for answers. You can look at the rabbit, the tiger, or the whale and let me know what you think is correct. Seeing lots of emojis out there. Thank you guys for participating. If you select the whale emoji, you would be correct. In the step-by-step outline of the SLR process, you learned about all the steps, including step 5. Case managers will meet with the member identified team, or MIT, to review support change needs. After alternate options are exhausted, you'll review the SLR process and gather details for the SLR request form. Once this is completed, please follow the remaining steps in the outline. The case manager will need to complete an SLR form and then have the member, guardian, and providers review the request for accuracy. Your supervisor will also review the support level review request form prior to submission. Once the review is completed and the SLR form is approved, the case manager can ask their case management agency support level review point person to submit the SLR form to the support level inbox. All right, we're going to ask Brianna to come back on for us.
All right. So as mentioned, we have made several updates across all existing documents and developed additional materials to support case managers with completing support level reviews. I will begin with a brief overview of the updated and newly created documents, followed by a live demonstration to walk through how they connect and function within the overall support level review process. The updated support level review form captures a complete overview of the member's needs and highlights any gaps between the member's assigned support level or service rate and the support that they actually require. The desk guide is your go-to resource for everything support level review. It provides a step-by-step walkthrough of the form with guidance on how to answer each question and what information is important to include. It's also the default training manual for the support level review process, offering extensive background information, helpful guidance, and best practices for the support level review process. The support level review pre-submission checklist for case managers is embedded into the desk guide and is intended to be used as a resource prior to submitting the support level review request. The support level review process provider responsibilities is a new document specifically for providers to outline their responsibility in the support level review process. The support level review process for HCBS waivers provides a general overview of the support level review process from start to finish. This is an updated version of an existing document. The service utilization spreadsheet was developed as a companion tool to support with completion of the service utilization section of the SLR request form. It can also be used anytime you need to share a clear summary of utilization with the member's team or service providers. We'll walk through how to use this tool during the live demonstration coming up. We'll now transition into a live demonstration of the updated desk guide, the revised SLR form, and the new service utilization spreadsheet. Together, these tools were intentionally designed to create a more streamlined and cohesive process, supporting case managers from initial preparation through final submission of a support level review request. All of the updated support level review process documents are now available on HCPUF's long-term services and supports case management forms and tools webpage under the ISLA/SIS resources tab. All right, we'll first take a look at the desk guide. Thanks so much, Lydia. Alrighty, so here is our updated SLR desk guide. This is where our support level review process will begin. The desk guide is the one-stop shop for all SLR needs. Our focus today will be on highlighting a few important updates rather than a full page-by-page walkthrough. The first section I want to highlight starts on page 7, the pre-submission checklist. This checklist is designed to be used before starting the support level review form. It walks case managers through key considerations to ensure the request is appropriate, complete, and well supported prior to submission. Because SLRs often involve complex member situations, this tool helps you think through those factors up front and reduce the likelihood of follow-up clarification. This checklist is embedded within the desk guide intentionally, as the desk guide SLR form and service utilization spreadsheet are meant to be used together as one streamlined process. Next, on page 10 of the desk guide, you'll see screenshots included of the updated SLR form paired with step-by-step instructions for each section. For example, the member information section is shown, and directly beneath the screenshot is clear guidance explaining what information should be entered. Each section on the SLR form is addressed in the desk guide, with additional context and clarification provided. This is intended to reduce guesswork, promote consistency, and ensure submissions are complete and aligned with expectations. Jumping down to page 18 of the desk guide. Awesome. Thank you. State plan benefits, the early periodic screening, diagnostic, and treatment, or EPSDT benefit, and the SLS exceptions process are explained in further detail. In particular, EPSDT is an important Medicaid benefit for members under age 21, and understanding how and when it applies can significantly impact the services available to a child or youth. We encourage case managers to spend time with this section to strengthen their understanding of when these benefits may be appropriate to consider within a support level review request. Starting on page 22, the test guide shifts from establishing baseline information to clearly presenting the member's current needs and identified discrepancies. This section of the desk guide focuses on how to effectively articulate changes in the member's acuity, emerging risks, or shifts in support needs. It also includes CHIRP-specific guidance, such as the Serious Emotional Disturbance or SED attestation form, and considerations for special circumstances. The intent of this section is to help case managers clearly frame why a change in support level is being requested and ensure the narrative aligns with policy and review expectations. Finally, on page 33, the desk guide includes the provider responsibilities document. So this document can be shared as a standalone resource with providers and MITs prior to meetings. Including the full text within the desk guide is intended to make it easily accessible and simple to reference. The purpose of this document is to provide clear structure for provider involvement in the support level review process and to support case managers in requesting specific relevant information from providers. We are asking case managers to summarize and integrate provider input throughout the form, particularly as it relates to new or updated support needs. Providers should specifically address questions 8, 9, and 10 in the form, which focus on how funds will be used, contingency planning, and the daily rate breakdown. This section is required for all SLRs, and it is especially critical for members with negotiated rate requests. All right, we'll be looking at the updated support level review form together next. Thanks, Lydia. Upon first glance, you'll notice that the updated support level review request form is very similar in structure to the previous version. The main change is that it is now a fillable Word document instead of a PDF. The fields include drop-down menus, fillable text boxes, calendar entries, check boxes, and guided open text prompts to help ensure complete responses. The first section collects the same basic member information as before. For today's demonstration, we've highlighted areas where updates were made to the form. Those highlights will not appear in the final version. Once you enter the member's last name and date of birth, built-in macros will automatically populate the footer throughout the document. Please do not modify the formatting, as that may disable this feature. On page 2, you'll see a list of checkboxes for the member identified team or MIT members. These are now listed in alphabetical order, and we've added additional options. Many of the new MIT roles were included to better reflect children and youth cases, aligning with the integration of CHIRP into the support level review process. You'll also notice throughout the form that language within certain questions and response prompts has been updated to account for children and youth cases. These updates are intended to ensure the form fully supports the broader populations now included in the support level review process. Section 2 begins with an explanation of waiver services and utilization. While utilization data is important, the panel is most interested in the story behind the numbers, not just the number of units authorized, used, or the percentage of utilization. We're looking for context. If there is over or underutilization, what is driving that? Are there barriers to accessing services? Have there been changes in the members' needs that the utilization percentage alone doesn't fully capture? This section is your opportunity to provide that narrative. There is also a designated space to insert the service utilization information from the new service utilization spreadsheet, either by copying and pasting or inserting a screenshot to support the explanation provided. Section 3 covers state plan benefits and additional supports. This section includes a series of checkboxes, some familiar and some newly added. These are intended to serve as a starting point for identifying the medical, behavioral, health, natural supports, and community services the member is currently receiving or accessing. After selecting the applicable boxes, please use the free text section to provide detailed explanation and context. The check boxes identify the supports in place, but the narrative helps the panel understand how those supports are functioning and whether gaps remain. Section 4 provides an overview of any discrepancies between the most recent assessment and the member's current activities of daily living, or ADLs, and care needs. In this section, please summarize any meaningful differences between what was identified in the assessment and what is currently being observed. Focus on what has changed and what is now required to maintain the member's health and safety in their current placement. This may include changes in frequency, duration, or overall scope of care across various settings and ADLs. We encourage case managers to be as specific as possible, particularly when care needs differ from the original assessment. This is the section where you can clearly describe the type and level of assistance the member requires, including how those needs may vary depending on the setting. Section 5 is an overall summary of the member's exceptional needs and the key factors contributing to the support level review request. This should include any recent diagnoses, health changes, or other developments that have led to the need for the increased support. We are also asking for a projected timeline for how long this increased level of support may be needed. In addition to clinical factors, this section should capture relevant contextual or environmental considerations that impact the member's situation. The desk guide provides additional guidance on how to help structure the summary and ensure all relevant details are included. Section 6 provides a summary of recent member meetings. This may include member-identified team meetings, service plan meetings, creative or complex solutions discussions, IEP or school district meetings, or any other relevant care coordination meetings. Please summarize the key discussions, outcomes, and recommendations from those meetings. In addition, include any recent critical incidents and note any referrals made to outside or supportive services. This section helps demonstrate the broader care coordination efforts underway and provides context for the support level review request. Section 7 applies to DD and SLS waivers only and focuses on risk factors. In this section, please summarize any rights modifications, supervision levels, or other restrictive interventions that may impact the member's support level review request. This helps the panel understand the level of oversight required and any safety considerations that are influencing the member's current support needs. Section 8 addresses how the additional funds will be utilized. Please provide a clear summary of the plan for the requested funding, including how it will be directly supporting the member's identified needs. This may include any relevant input from providers. If providers have prepared documentation to support the support level review request, please summarize the key points here and incorporate that information into this section rather than attaching it without context. Next, Section 9 addresses what will occur if the requested funding is not approved. Please outline the potential impact on the member, including whether their placement would be at risk or whether specific services would be reduced or unavailable without approval. This section should also include any backup or contingency plans, as well as alternative resources that could be explored if funding is not approved. The goal is to clearly demonstrate both the level of risk and the planning that has been considered. Section 10 is the provider statement section. As we reviewed earlier in the desk guide, the provider responsibilities document is intended to support clear communication and structured provider input during the support level review process. When a potential support level review is discussed during a member's MIT meeting, case managers are encouraged to share the draft support level review form with providers to help ensure that all relevant information is captured and accurately reflected. A formal signature is not required. However, documenting the date the provider reviewed the information can be helpful for clarity and tracking purposes. Finally, all SLR forms and negotiated budget information should be sent to the new inbox, hcpf_support level@state.co.us. All right, we'll jump over to the service utilization spreadsheet next. Thank you so much, Lydia. All right, last but not least, I want to introduce the new service utilization spreadsheet. As previously mentioned, this tool is available on HCPUF's long-term services and supports case management forms and tools webpage and was designed to generate a clear summary of a member's service utilization for inclusion in the support level review form or for other utilization review needs. At the bottom of the spreadsheet, you'll see separate tabs for each waiver. You'll begin by selecting the tab that corresponds to the member's waiver. From there, you'll choose the specific waiver services the member is receiving using the drop-down menus, which are pre-populated with all available services for that waiver. Then, you'll enter the number of units authorized and the number of units billed on the member's current service plan. The spreadsheet will automatically calculate and display the service utilization percentage, providing a clear and standardized view of utilization to support your support level review submission. Alrighty. After reviewing all of the new support level review materials, does anyone have any questions? Please feel free to pop them in the Q&A.
Thanks, Brianna. I'm just working on getting our PowerPoint back online here.
Perfect. It's a great segue. I'm not seeing anything in the Q&A, or maybe I am. 246. I don't know if those are specific. Aaron, you're typing an answer to Travis, I see.
Am indeed. Thanks for checking.
All right, are we seeing the temperature
right.
check on screen now?
We're back on the screen now. We're all
right,
good. So now we'd like to take a minute to gauge how everyone's feeling about the new and improved support level review process updates introduced today. Find the emoji that best represents how you're feeling about the support level review update. Seeing all the animals, lots of whales, turtles. Ooh, a thumbs up too. Great. Thank you all so much for your responses. We really hope that all of the new and updated resources will better support all of you with navigating the support level review process in the future.
Thanks, Brianna. Thanks, everybody, for all your responses and participation. All right, let's discuss some of the SLR form requirements. Again, we want to remind everyone to carefully review and address each question in the SLR request form with updated and individualized responses. Case managers might be feeling intimidated or worried about completing the support level review form. When I was a case manager, the best piece of advice I got completing an SLR was to remember to paint a picture with my form answers. Remember that the department does not know your member or the situation. You can use the SLR form to tell the story of your member. It's also a good place to document all the efforts you and members of the member identified team have made prior to completing the request, to take credit for your hard work and other avenues you have attempted. Tell us some of the ways the case manager and MIT have been trying to meet the member's needs. Give us some idea of what has already been attempted and why a support level review is needed now. Case managers will need to demonstrate with their writing that the member's needs exceed what the support level accounts for in their support level review request form. The SLR request is a panel process to determine the member's support needs based on the information provided. The SLR decision is not a service denial, so it's not something that can be appealed. However, if anything changes, like the member's support needs, you can always submit a new request with that updated information. The purpose of the panel is to examine, does this member have substantially higher needs than others at the same algorithm support level? Your role as the case manager is to answer this question as best as possible. Remember that the SLR panel does not know your member. Your documentation in the SLR form is the way in which you'll be communicating all of the member's needs and any current concerns that have led you to completing a support level review request. Take the time to summarize this person's story with current details and specific targeted outcomes. Make sure all the information included is person-centered and clearly describes the member's current needs in detail. On this slide, we have an example of language that could be used in an SLR form to give relevant and specific details. So for example, Mr. H needs physical assistance instead of verbal prompting for toileting 5 to 6 times a day for 20 minutes. Remember to only include current documentation. The SLR form information must reflect the past 12 months. Please remove all outdated details. Case managers complete the support level review request form for your members because you have extensive knowledge of their support needs. Case managers must not complete a support level review solely based on a caregiver or provider wanting to generate more revenue. Support level reviews must be based on the member's current support needs. Remember to reach out to your case management agency leadership if you are not familiar with benefits, supports, and services available through other resources that HCBS waiver members can also access. These other resources should be considered as payers of first resort to meet your members' support needs. This list includes Health First Colorado, also known as Medicaid State Plan Benefits. This also includes Community First Choice or CFC services now, the Early and Periodic Screening, Diagnostic and Treatment or EPSDT benefits, Home Health, or Regional Accountable Entities or RAES. Health First Colorado benefits can be accessed by all HCBS waiver members. This program now includes Community First Choice services. The Early and Periodic Screening, Diagnostic and Treatment, or EPSDT benefit provides comprehensive and preventative healthcare services for Health First Colorado members that are 20 and under. EPSDT services are key to ensuring that children and youth receive appropriate preventative, dental, mental health, developmental, and specialty services. The home health benefit is also for Health First Colorado members, and this program provides services from a licensed and certified home health agency for members who need skilled or unskilled home health services. There are two forms of home health, acute and long-term. Regional accountable entities, or RAEs, can help members to understand and manage their physical and behavioral health care needs. RAEs can also help connect members to providers and with other resources such as transportation, food assistance, or social services. Lastly, remember to update the SLR form with individualized information that is current based on your members' support needs. We're going to share some informational pages with you guys on the many benefits and services I was just talking about, so you have those resources as well. Now we're going to talk about some of the common support level review form mistakes. Members on the HCBS DD waiver cannot access an increase in daytime or behavioral supports through a support level review request. This waiver does not have a service plan authorization limit or SPAL, and a support level increase would not increase the number of units available to a member in their certification year. Do not simply copy and paste information from a previous SLR request into the new form. Many SLRs are not approved due to insufficient justification for the increase in funding. The SLR panel relies on detailed, current, and individualized information to make determinations. Please remember the support level review panel has access to the CCM and bridge systems. There's no need for you to copy and paste from documents such as the level of care assessment in the SLR form. Instead, we would like for case managers to summarize any key points from their assessments and documentation to explain their members' needs clearly. Don't answer sections with generic or vague responses. For example, needs more assistance does not provide enough detailed information to the SLR panel. Remember, the SLR process is not permanent, guaranteed, or backdated, and this is not a provider-driven process. Let's work through a few more knowledge checks to make sure everyone's understanding some of these important points. Here's our question. If a member has been previously approved for a support level review increase, can a case manager simply copy and paste information from the previous form into the new SLR form to apply for an extension? Take a look at the answers for the rabbit and the tiger and let me know what you think. I appreciate seeing all those tigers. That is correct. Case managers are responsible for completing a new support level review request with current detailed information regarding the member's unmet support needs, changes, and outline purposes for a support level review increase or continuation to be approved. We have one more question for you in this section. Do case managers need to be knowledgeable of the additional programs and supports available to their members outside of the specific services in their HCBS waiver? So we have a turtle and we have a whale here. Let me know what you guys are thinking. Love it. I'm seeing lots of whales. Thanks, everybody. That is correct. Case managers need to have a good general understanding of the additional programs and supports available to meet their members' needs. The home and community-based waivers are considered the payers of last resort. Case managers must ensure that members are referred to the resources listed above prior to pursuing a support level review request. All right, now I'm going to pass the presentation to Karina Barrick for some information about the SLS exceptions process.
Thanks so much, Lydia. Hi, everyone. I'm Karina Barrick. My pronouns are she, her, hers. We're going to take a quick beat and briefly discuss SLS exceptions as another option for SLS members and when this process may intersect with support level reviews. So when working with members on the SLS waiver specifically, it's valuable to understand what options are available and when additional supports or services are needed. In addition to the SLR option, members on the SLS waiver also have options to access the SLS exceptions process. Case managers can consider the SLS exceptions process when a member is at risk of enrolling on the DD waiver because of unmet needs. This typically happens when the member has used most or all of their SPAL, if applicable, and they have exhausted available services because of those individual service unit limits. The key point here is that the members assigned support level is appropriate, but their urgent needs can't be met because of those unit caps or SPAL limits. The SLS exception doesn't change the member's support level. And they are short-term approvals, so 1 year or less. And currently, the exception request is reviewed and processed by the department's utilization review contractor, which is Telegen. To submit an SLS exception, case managers should ensure that document clearly supports the urgent need, why the caps are insufficient, why the member is at risk for needing to enroll on the DD waiver. And in some cases, an SLS exception can be used alongside a support level review, but only when the criteria for both processes are met. For specific training and additional guidance on this process, we have some resources that you can refer to, including the SLS exception website, the utilization review, utilization management website, and the most recent operational memo on this topic, which will be put into the chat. Next, I'm going to highlight a couple of shifts that are impacting SLS members enrolling or renewing certification periods beginning or after July 1st of 2025. These group of folks are a part of that staggered enrollment option into Community First Choice or CFC. First is the Service Plan Authorization Limit or SPAL. This will no longer apply to individual members as they enroll onto CFC. Instead, members will be subject to an overall waiver cap. The current overall waiver cap amount can always be found in the rate and fee schedule. And as case managers, you would ensure that the total of authorized services in the plan don't exceed that cap, much like you do or did with the SPAL. Next is proration. If a member's certification period is less than 12 months, for example, because of a mid-year enrollment or an eligibility change, the overall waiver cap will be prorated based on the length of that certification period. This has been effective previously with the SPAL. It will continue to be applicable to the waiver cap. So you'll just need to make sure and be aware that you're calculating and planning against that prorated cap, not the full annual amount in those specific situations. And finally, where these updates connect with SLS exceptions, SLS exceptions can still be used to exceed the individual service unit cap. This part doesn't change, but SLS exceptions can't exceed the overall waiver cap. So even if an exception is approved to go beyond a specific service unit limit, the total cost of the service plan must still remain in that overall waiver cap. On this side, you see a version of the SLS waiver options flowchart. As a case manager, you can use this chart to determine what process would be the best option when a member is needing to increase services to meet their needs. Walking through the visual part of the chart on screen, case managers would start with identifying if an increase in services would help meet needs. If yes, then 2, is there room in the overall waiver or unit limits? If no, then does an individual need a support level increase? Yes or no, move on to an SLS exception process. This chart can help you determine if a member would benefit from a service plan revision, a support level review, an SL exceptions request. The full chart, along with a written version of the decision tree, is currently available on the SLS exceptions website. Thanks again, Nadine, for dropping these in the chat. Before I pass it back to Lydia, I wanted to just pause here and ask if there's any questions that we needed to address regarding SLS exceptions. Happy to answer those. Happy to also review the Q&A and answer those there.
Thanks, Karina. We do have one person with their hand up, Audrey Edelman. Not sure if your question is about SLS exceptions. I'll go ahead and looks like you put your hand down. No worries. Sometimes those hands pop up when we're selecting those emojis. But as Karina mentioned, if you have any questions about the SLS exceptions process, feel free to put those in the Q&A. Thanks, Karina. All right, let's take a look at risk factors. Risk factor values are clearly defined in rules and regulations. Members on the HCBS DD and HCBS SLS waivers are evaluated for risk factors at least annually or when significant changes to the member's needs are identified. Case managers who work with these waiver populations must have a clear understanding of the definitions for extreme safety risk to others and extreme safety risk to self. Remember that risk factor values do not apply to HCBS CHIRP members. Risk factor discussions can occur during the annual service planning meeting or during member identified team meetings based on the member's needs. Case manager supervisors document the risk factors by selecting answers for extreme safety risk to others or extreme safety risk to self in the Bridge System Client Information Panel. The case manager completing the support level review form must ensure that they have discussed risk factor values with the member and the MIT prior to completing an SLR form. Case managers and supervisors need to be aware that the documented risk factors can impact a member support level. This is one of the reasons why risk factors must be reviewed at least annually and documented properly. Case management agency supervisors are responsible for documenting the rationale behind the risk factor determination. Members who meet risk factor requirements are required to have a rights modification with a current signed informed consent or parole, probation, or court orders that denote the member requires 24/7 line of sight supervision and or a controlled environment that is necessary to meet the member's needs. Case managers and their supervisors must ensure that risk factors are entered into the client information panel annually or more often. If the calculated risk support level is left blank in the bridge, it will not connect to the support level history tab or the pre-prior authorization or PPA. The case manager will get an error while trying to create the PPA and authorize services. Case managers and supervisors can confirm the correct process has occurred by knowing that each time a new risk factor line item is added to the Bridge Risk tab, the Calc RF support level box will have a support level number listed. That's shown in the screenshot on the screen here now. If the member does not meet the risk factor criteria, the case manager will enter the algorithm or base ISLA support level. If the member does meet one or more of the risk factor definitions, the case manager must calculate the increased or calculated ISLA support level using the external manual calculation sheet and then add the calculated support level to the Calc RF support level box. Case managers can work with your case management agency SISLA contacts if you have any support needs regarding this section of the bridge. It's time for a couple more knowledge checks. Are members on the HCBS DD and HCBS SLS waivers required to have an annual member identified team discussion of their risk factors? Let me know if you think it's a bunny or a tiger, please. Seeing lots of responses now. Thank you. Case managers and case manager supervisors will work together to ensure that the risk factor, as discussed with the member and the member identified team, is happening at least annually. Remember, the case manager supervisor will ensure that the risk factor values are documented in the bridge. Thanks for all those tigers, folks. All right, one more question for you guys today. Can members on the HCBS DD and SLS waivers qualify for risk factor values based on their disability diagnosis, activities of daily living, and general safety concerns presented by their MITs? We have a tiger answer for you here or a whale. Let me know what you think. I am seeing lots of whales. Thank you, folks. If you've selected whale, you are correct. Rules and regulations require that members have a current signed informed consent for the rights modification or parole probation court orders documenting that need for 24/7 line of sight supervision and or a controlled environment documented in the member's record. These are required prerequisites that must be in place prior to documenting a yes response for either of the risk factor values in the bridge. All right, now I'm going to pass it over to Erin.
Everyone, thanks for making time for us today. My name is Erin Munoz. My pronouns are she or they, and I am our Case Management Delivery Unit Supervisor here at HCPUF. For the next portion of our presentation, we're going to outline some of the most common themes the SLR panel sees when requests are not approved. Now, the purpose of reviewing these is not to criticize or call out case managers in any way. Instead, it's about transparency and helping you all strengthen your SLR submissions. So the first and most frequent theme we see as to why an SLR is not approved is due to insufficient justification. The SLR form must clearly show why the current support level is not adequate. It's not enough to describe the member's needs. We need case managers to demonstrate that those needs exceed what the current support level accounts for. Another common thing we see for non-approvals occurs when the panel determines that a member's needs may be better addressed through the Regional Accountable Entity, or the RAE, or other available state plan services. So this might include things like exploring and utilizing EPSDT benefits for members under the age of 21, utilizing available mental or behavioral health supports through the RAE, exploring available trauma-informed care services through the RAE, potentially acute or long-term home health services, or private duty nursing services. A key thing to remember here is that state plan services in EPSDT are the first payer, so the SLR panel will look closely to ensure that those options have been fully explored and documented before approving additional waiver funding. If you did try these things and those resources were attempted but were insufficient, we need you as a case manager to clearly explain that in the SLR form. Be sure to include dates of any meetings, outcomes of those meetings, and any other barriers you might have encountered along the way. This next slide goes over a few additional reasons we see non-approvals. One of those is when existing waiver services have not been fully utilized. A very common example of this might be when a member's support needs are very behavioral in nature, but no behavior services or behavior line staff are discussed or utilized. Another one we commonly see as the panel is when case managers mention that there is a specific need for one-on-one support at day program for a member with the support level of a 1 through a 5, but Tier 3 supported community connections is not discussed as an option or utilized. Ultimately, the panel is going to ask you guys, have all allowable waiver services been maximized before requesting the higher support level? We also do see non-approved requests when they include non-allowable items. and this might include things like respite funding within the CHIRP or DD residential rate. As a reminder with this one, the residential daily rate includes access to backup residential providers for these members. The residential agency is responsible for identifying backup providers, and the member's daily rate will go to that backup provider for those dates of service. We also commonly see asks for funding for services or items that are not covered under the waiver, such as home health services, durable medical equipment, or other items that should be covered under state plan benefits. There's also times when the SLR process is being used when another process needs to be followed first. Some examples of this might include risk value requests that need to follow Informational Memo 22011, Tier 3 dehabilitation limit exceptions that need to follow IM 23033, or SLS unit caps SLS unit cap issues that need to follow that SLS exceptions process that Karina went over for us, and that follow Memo OM 25070. The big takeaway here is to make sure you're using the correct pathway before submitting an SLR. Sometimes the right answer isn't a higher support level, it's a different process or a different resource that needs to be tried first. All right, so next, let's clarify disputes. For members enrolled in our DD waiver, the SLR panel decision is conclusive. The support level only affects provider rates for services. It doesn't change the amount of services or those service unit limits. Thereby, it's not appealable or disputable. However, for members in SLS, there is a limited dispute option. If the member disagrees with the panel's decision, they can request a review by the executive director's designee within 15 business days of that decision. If the member or their guardian requests a review, the case manager would send an email to our SIS or support level inbox with that request. From there, HCPF will review and will respond with the decision via email. All right, so I want to pause here and just emphasize something really important about non-approvals. When the SLR panel denies a request for a higher support level, it does not mean that there's no hope for the member. It also doesn't mean that the member's needs aren't real, and it doesn't mean that you as a case manager did something wrong. What it does mean is that based on the documentation submitted, the panel determined that either the justification did not clearly demonstrate a need above the current level, or that other services, supports, and alternate processes need to be tried first. Often the feedback from the panel in that non-approval gives direction for next steps. It might point to leveraging existing waiver services that are not being fully utilized, exploring state plan benefits, utilizing behavior supports, considering SLS exceptions, and ensuring that risk factors are appropriately documented. If additional interventions are tried or new information becomes available, an updated SLR can absolutely be resubmitted. The process is not closed forever. It can be revisited whenever it's appropriate. All right, so on this slide, I really want to address something that a lot of case managers feel, but they don't always say out loud. There's a lot of pressure on you all as case managers to get every request approved. Families want that approval, providers want that approval, your MITs want approval. But it is not the case manager's job to guarantee an approval. Your role as a case manager is to ensure that the form is complete, make sure it contains the most up-to-date and accurate information for that member, ensure that justification is individualized, detailed, and supported by current data, and ensuring that alternate options are all being explored. It's the panel's role to really make that final decision. So sometimes even a very well-written, thorough request will not be approved, and that is not a reflection on your performance as a case manager. Your responsibility is accuracy, completeness, and professional documentation, not controlling the ultimate outcome. Whenever a request is not approved, your next step is then to review that feedback, talk with the member's identified team, identify any next appropriate actions, and determine whether a future updated submission makes sense for that member. This process is really about integrity and supporting members appropriately, not about winning or losing a request. So we spent a little bit of time talking about non-approvals and clarified that not every denied SLR request is disputable or appealable. So as we move into this section, I really want you to listen for when is an appeal appropriate, when is it not appropriate, and what is the case manager's responsibility when an appealable action occurs. This is an area that arguably causes a lot of confusion, and there's a few important distinctions. For DD and CHIRP members, SLR panel decisions are conclusive because that support level affects provider rates, not the member's service availability or unit limits. These SLR non-approvals are not appealable. However, for our SLS members, there are some nuances. If a support level non-approval results or decrease results in a reduction, a suspension, or a termination of services, then a notice of action needs to be issued to that member, and the member may choose to appeal that decision. However, it's important to note that a non-approval of an SLR increase is not the appealable piece. The notice of action needs to capture the service denial, decrease, or termination as the reason behind that notice of action, not the service level decrease itself. As a reminder, if a team does disagree with the decision, they can submit a new updated request with additional information. And this part is really about clarity and regulatory alignment, not about limiting advocacy or support for that member. And with that, I want to walk through a couple potential appeal scenarios with you all. So for this first scenario, we have our member Alex. Alex is enrolled on the DD waiver. The team requested an increase from a support level 3 to a 5 due to behavioral and safety concerns. The SLR panel reviews all the documentation submitted, and they determine that Alex's needs can be met within the current support level using existing waiver services and state plan benefits. Thereby, the panel does not approve that increase. Alex's guardian is pretty upset by this and says, "We want to appeal this decision." I want to pause here and ask all of you, using your thumbs up or your thumbs down emoji, is this an appealable situation? Couple thumbs down. Awesome. Thank you guys for your feedback there. And you would be correct. This is not an appealable situation. And here's the why behind that answer. Firstly, Alex is on that DD waiver. Next, the panel did not reduce, terminate, or otherwise decrease any unit limits for that member. The SLR panel simply did not increase the provider rate associated with those services. Under the DD waiver, the support level affects that provider reimbursement rate, not the member's service authorization or units. Because no services were reduced, denied, or terminated, this is not an appealable action, and that distinction is really critical, so good job. So for this situation, what would the case manager do instead? As next steps, the case manager would want to meet with that member-identified team, and in that meeting, that case manager would explain clearly that this is not an appealable action, then review the panel's feedback carefully and determine whether there's any new information available, any additional supports that the panel might have suggested have been attempted, or if any needs have significantly changed. If any of those things are true, the team may submit a new and updated SLR request. This really reinforces an important mind shift that an SLR non-approval is not the end of advocacy. It just means justification did not meet criteria at this time. As case managers, remember you're responsible for submitting a solid person-centered request, not guaranteeing approval. And with that, we're going to move on to scenario 2, which is a little more nuanced. So for this scenario, we have our member Jordan. Jordan is on the SLS waiver. Jordan previously qualified for a risk factor value, which raised his support level from a 3 to a 5. After showing considerable improvement, the member identified team determined that he no longer meets that risk factor definition. As a result of that improvement, his algorithm support level dropped down to a 3. The team decides to submit an SLR asking to remain at a support level 5, but ultimately the panel does not approve this request. There are a few really important considerations to add into the mix for this scenario. Our member Jordan has not yet transitioned to CFC, and he is still under SPAL limitations. Because of this, Jordan's support level decrease results in a decrease in his SPAL, and thereby a decrease in the amount of services he's able to fit into a service plan. With that additional nuance and information, I want to pause and ask you all again, is this situation appealable? Beautiful. You guys would be correct. This is an appealable situation. In this case, the case manager would need to issue that long-term care notice of action, or NOA. The member or their legally authorized representative do have the right to file an appeal here. And here's the why behind that. As a reminder, Jordan was on the SLS waiver. That support level decrease ultimately resulted in a reduction of his authorized services. That support level reduction ultimately impacts his access to services. When a support level decrease directly causes a reduction, suspension, or termination of services, it becomes an appealable action. Appealability really hinges on whether the decision reduced services, denied services, terminated services, not simply whether the team disagrees with the SLR outcome. Now, before I hand the presentation back to my colleagues, I do want to check in with you all. Do these nuances make sense? Did any questions maybe pop up during those scenarios? And if the question isn't here right now, that's okay. I will be keeping an eye on the Q&A for you guys too. Okay. Thank you all so much for your time. Lydia, I'm going to hand it back to you.
Thanks, Erin. I do see that we have a couple folks with their hands up, so I don't know if you want to pause for some questions on your section first before we hit the training wrap up.
Totally fine with me, yeah.
All right, I see the first one who has their hand up, I see is Monica Folsom. Go ahead, let's move to unmute. Sorry, I'm having a hard time getting that button to work for Monica. If for some reason your hand's up but you did not mean to raise your hand, you can go ahead and lower it. Sorry, there we go. Monica, are you able to talk to us? I'm seeing her unmuted, but I'm not hearing her. Is that what's happening for you too, Erin?
I am not hearing her either. It
Okay.
does look like it was unmuted. Monica, do you still have a question for us?
All right, if she has a question, she can put it in the Q&A.
Yeah, okay, perfect.
Okay. Let's go ahead to Heidi. Oh, no, Heidi just put her hand down, so maybe just Joanne is left in the queue. Joanne, I'll see if you can unmute.
Yeah, can you hear me?
Yes.
Quick question, Erin. In the situation with an SLR, let's say it's a CFC-based client on SLS and it was denied, but with the overall cap being at a certain rate, would that still be something that would be denied? Like, let's say it's for the client wants more, I don't know, day program or something, right? They just want more funding to be able to, I don't know how to phrase it. Basically, if somebody is on SLS plus CFC and they didn't, you guys deny, or the SLR panel denies a support level increase, but it's only going to increase the payment for the provider, would that still be something that would be able to be disputed?
Good question. So that one could certainly be disputed. The member or the guardian could reach out and ask for our executive director or their designee to review that one within 15 days of the decision, but that would not be a appealable action since no services were actually terminated, reduced, or denied as a result of us not approving that level increase.
Okay, but that would still constitute the same thing as like DD, right? Because technically speaking, the overall funding wouldn't increase regardless because now there's an overall funding cap on SLS once you go on to CFC. It would just be the provider rates that would be changing, correct?
Correct. So that piece would not be appealable. It would be a little different if there was a scenario where the support level dropped due to risk factor values or another extenuating circumstance like that. But for the scenario you're outlining, that would not be an appealable action in that case.
Okay, but the funding rate overall would not change, correct? Like there would not be any increase in funding, even if for the client, like the overall funding would not increase. It would just be the funding for the service provider would change.
If I'm understanding your question correctly, yes, you are correct there.
Cool. Thank you. That's all I
Yeah,
wanted to know.
of course. Karina, I saw you pop on. Do you have something to add there?
I just wanted to confirm, Joanna, that regardless of if it's an SLR or an SLS exception, that overall waiver cap still applies. So I think Aaron confirmed that. I just wanted to second that.
Thanks, Karina. Appreciate you.
Thanks, ladies. I don't see any other hands raised. I do see some questions from folks about different, perhaps, sorry, I lost the words there, non-approval questions and potential appeal questions. So I'll let Erin take a look at those and we'll come back to the questions in just a couple minutes.
Thanks, Lydia.
Thank you. All right, we just have a couple more slides for you guys. I want to let everyone know that when you end the Zoom call today, you will automatically receive a survey from the department. We ask that folks attending this training, please complete the survey today. We love to get your feedback and we know your time is valuable. So we want to make sure that you walked away with what you needed from this training today. So when you exit, just remember there's a Zoom link that will open. We'd love to get your feedback on that survey. As we talked about in our presentation today, we covered a lot of different resources for you guys for the support level review process. I want to specifically remember to highlight for you guys that LTSS case management forms and tool page currently has all of our updated resources that we covered in our training today already posted. So the SLR request form, that updated SLR request form desk guide, there is an SLR panel schedule there. We also talked about informed consents for rights modifications in case you guys have any questions about that. We also wanted to list out some related memos we covered today. The support level review auto extension memo, supports intensity scale complaint process updates, risk factor determination and process flow memos, and the overview of the support level review processes and revised request form. The department is working on issuing an updated operational memo about the support level review request process that we demonstrated in this training today. So sometime this month, you will also see an operational memo that's new from the department that will align the direction you heard today, which is that HCBS, DD, SLS, and CHIRP members will all be using the support level review request process when asking for a higher support level. I saw there were a lot of questions in the chat today about when to start using the new support level review request form. So I just want to call out again to folks that the department is requiring case management agencies to start using the new forms and paperwork on April 1st. If you choose to use that form and the new paperwork prior to April 1st, there's no issues with that. But you do need to know that on May 1st, the department will no longer accept the old support level review request form. So please be sure that starting on April 1st, you transition to those new documents so that you don't face any kind of rejection for just that clerical error. We also want to note that the Google form for the CHIRP process asking for support level increases. That Google form will also stop working on May 1st. So folks will be using that support level review request form we demonstrated today for those CHIRP members as well. As I mentioned in the beginning, we are going to have some office hours this month. So next week and the week after, we have 2 different sessions for office hours. We want to remind case managers, their supervisors, and the agency SISLA contacts that you are welcome to attend these office hour sessions to bring any specific questions you may have after reviewing this training and our updated forms on the HCPF website. And that registration link should be in the chat for you guys. All right, we do want to take some time to open it up for live questions. So remember again to check your screen and see if your hand raised. I see I have one hand raised in the crowd. And then we may have some open Q&A that we can go to as well. So it looks like we'll start with our raised hands. So let's start with Heidi Borrego. Heidi, are you able to unmute? Nope, looks like maybe Heidi put her hand down. I'm gonna go to some of my friends on the call. Erin, I don't know if you can help me to determine if there are some Q&A that you would like to go over live here.
I am peeking through there now, and I'll see if there's any that we might want to share with the larger group.
Thank you.
So far, not seeing any that I think need to be for the full training. We have quite a few nuanced ones.
Right, so Erin, are you saying no Q&A to review at this time?
I don't think any that we need to review with the larger group. Thanks for checking, Lydia.
All right. Feel free to raise your hand if you have any questions you'd like to ask live. We did want to share our contact information with folks. Again, we talked about this earlier in the presentation. So as a reminder, the support level review inbox is the email address the case management agency support level review contacts use to submit the support level review request form and any additional required documentation for the request. If you have any additional questions or concerns about the support level review process in general, we want those sent to the case management inbox. That email address is also listed here on screen, and it's the HCPF_HCBS_case management at state.co.us. We appreciate the time and the energy you guys have put into the training today. We thank you for all the things you do for our HCBS waiver members, and we look forward to seeing you at our office hours sessions later this month. We hope you all have a wonderful day, and we look forward to seeing you next week. Thank you. a few HICPUF staff still answering some Q&A, so I'll wait to end the training until we're able to get those answers in for folks. So if you're hanging out waiting for a question to be answered and you see someone typing, it's okay to hang out.
We're just wrapping up one final Q&A, Lydia. All right, the Q&A has been cleared. I'm checking to make sure there's no lingering follow-up ones under our answered questions real quick.
Responding to Zoe's question about ICAPs, and ICAPs don't need to be completed every year. We do encourage our case managers to double check that the responses seem to align with where they're at. Developmentally, as children grow, they learn and sometimes regress at very rapid rates. So we do encourage checking in on the ICAP, but an entire new ICAP is not always necessary. So it's up to the case manager if they check in on those answers and whether or not the team feels maybe an SLR is needed due to behaviors or increased needs. Maybe an ICAP would be necessary at that time.
Thanks for that clarification, Kathleen. I'm going to go ahead and end the Zoom webinar. Thanks everyone for joining us today.
Thank you, everyone. We appreciate you.